So bronchitis is an upper respiratory tract infection in which the infection tends to settle in the upper bronchial tubes. Classically, there's cough with that's bringing up some phlegm. There may be a low-grade fever with that. Majority of bronchitis are caused by viruses and so do not need antibiotics. But certainly if you've got a bronchitis that were to go over 2 weeks, then you may need antibiotics. It's very common that when you're bringing up phlegm that will turn green and yellow. That still doesn't mean that you need antibiotics for that. One little caveat would be if someone were to also have asthma or were to have a emphysema, sometimes this will make them more short of breath. If that's the case, that may be a time to see your doctor to get antibiotics. It may be time to make sure that you have your asthma medicine available and you use it if you feel like it that you need to. Generally, the fever doesn't get over 101. If the fever were to be much higher, 102, 103, particularly if the person says that they're feeling short of breath, that may be that the infection's gone even deeper down in the lungs and into pneumonia. That's something definitely to see your doctor for. A lot of times those are still viruses, and but almost always we still treat them because we don't know in the urgent care which type it is. Medication for bronchitis, usually I will use a cough syrup that will help bring up phlegm, like Cheritosin with codeine, or something that's used to thin out phlegm. While the Phenergan with codeine and the promethazine with codeine is frequently a stronger cough medicine to suppress the cough, in my experience, the mucus is normal, the phlegm is there. If we try to dry up the phlegm, a lot of times what we end up doing is thickening up the phlegm, and so your cough is better now, but when the medicine wears off, you've got to cough up and spit it out. Do you have to spit it out on the floor? No. A lot of times you can't. A lot of times all you can do is get it up here in the throat and then you swallow it. That's okay. That works. So bronchodilators, or your classic asthma medicine, does have a place for bronchitis, particularly if the person is feeling short of breath. Sometimes there's enough inflammation in the windpipe that the person will wheeze just like an asthmatic. And so putting them on a albuterol inhaler, using albuterol nebulizer machines, sometimes even put them on a short course of steroids to help relieve this inflammation will make a tremendous difference on how the patient feels in just 24 hours. Once treated, bronchitis generally is better within 48 hours. They may not be back to normal for a week, but they're usually better. You can tell they're better. If you're not better within 48 hours, it may be worthwhile rechecking with your doctor. If you're worse, such as the fever is higher, you're more short of breath, those probably an indication to go to the hospital emergency room.